My
Hello.
name is Sarah, and I'll be your nurse for today. I'm going to do a complete physical assessment, and the first thing that I need to do is make sure that the scene is safe. So the scene is safe, and I just washed my hands so they're clean. Can you tell me your name and your date of birth?
Bernice, 7/11/92.
Okay. So you're 21 years old? And can you
20.
tell me, you're 20 years old? Can you tell me where you are
I am in my house.
and the date today?
April 17, 2013.
Okay. Client appears dressed appropriate to age. She's alert and oriented, ×3. Now, I'm going to go ahead and say that I saw her walking in, so her gait was well balanced and symmetrical and even. Her base was shoulder width wide, and her arm swing was also symmetrical. Her nutrition status, her body weight appears to be within normal range for her body size and her body frame. Her body fat is evenly distributed. Her skin is dark brown and appears to have no lesions. There appears to be no deformities. As she's speaking to me, she speaks in English and she is articulate. Her content is appropriate to the conversation. She appears to not have any difficulty hearing. She interacts pleasantly with the examiner and cooperates. She is sitting on the edge of the couch right now. She's facing me. She's very relaxed and composed. She appears to be cleaned and groomed, appropriate to her age and occupation. She is dressed that way. She is giving the examiner eye contact, and now I'm going to go ahead and start looking at her hands. So the skin on her hands is dark brown. It's warm and dry with no lesions. The turgor is fair, and I'm looking at her nails, and the nails are smooth and the edges are rounded. The posterior and lateral skin folds are clean and they're intact. They're not broken up or anything. I'm going to go ahead and look at her scalp. Her scalp is clean. It's free of pests and lesions as well. Her scalp is smooth. Her cranium, you can set up. Her cranium is normocephalic. It's symmetrical as well. Can you raise your eyebrows for me? Can you puff out your cheeks? Can you smile? And can you frown? Her facial expressions indicate that her 7th cranial nerve is intact. When I press here, is it tender?
No.
When I press here, is it tender?
No.
So frontal and maxillary sinuses present non-tender. I am going to now do a confrontation test with you. Can you cover this eye with your hand? Can you tell me when you see my fingers coming in?
No. No.
And cover your other eye?
No. No. No.
Okay. This indicates that her second optic nerve, her second cranial nerve, her optic nerve, is intact. And now I'm going to check her vision to the 6 cardinal points. Can you follow my fingers without moving your head? Okay. No nystagmus was observed, and this indicates she was able to correctly follow my finger, and so this indicates that cranial nerves 3, 4, and 6 are intact. Now I'm looking at her eyebrows. They are symmetrical. They're like the same shape. Her eyelids, when they close, they approximate with her lower lids. Her eyelashes are evenly distributed. Her iris is dark brown. It's round and flat. Her sclera is white. Her conjunctiva, can you look down for me? Her conjunctiva is clear. And now I'm going to look at her cornea. ahead, please. Her conjunctiva is clear as well with no lesions. Okay, I'm going to look inside. You just look ahead. I see a red reflex. Her fundus is of a creamy yellow-orange background. And I'll let go. There were bright red blood vessels in all 4 quadrants, and they were non-engorged or constricted. And also the background was a light red color and it had no lesions present. So now I'm going to ask that you look at the wall in the back, and I'll look at my finger. There is proper accommodation, and once again, if you can sit forward, I'm going to shine this light. And there is direct and consensual accommodation. Direct and consensual constriction. So pupils equal round reactive to light and accommodation. Next, I'm going to look at her ears. If you can sit forward again, please. Her ears appear to be of equal size bilaterally. Is it tender? They're non-tender. There's no lesions present or observable from the outside. As I'm looking in, I'm pulling out and up. And there is some cerumen. The skin is pinkish, moist, and the tympanic membrane is pearly gray white, and there is a conal reflex. I'm sorry, a conal reflection. And now I'm going to observe her nose. It appears to be midline with no deformities. I'm going to occlude one of your nares and you tell me if you can breathe. Can you breathe? Okay, both nares are patent. Now I'm going to look inside. Can you put your chin up, please? Okay. Nasal mucosa is pinkish red and moist. The septum is non-perforated. It's not deviated either. You can look down. The turbinates are do not have any white exudate. And now I'm going to be looking inside her mouth. But first, her lips are pinkish brown. And can you smile for me? Her teeth are aligned and white. Her gums are tightly margined against the teeth. Can you come forward and open your mouth? Okay, I'm looking at her buccal mucosa and it's pink and moist. Do you want to re-wet your mouth? I don't know, you just look really dry. I can see the Stetson stacks. Can you say ah? I can see the uvula rising midline with the soft palate, indicating that cranial nerve 9 and 10 is intact. Can you come again? I can see the anterior palate, and it has transverse ruby across the top. The posterior palate, the soft palate, is smooth and movable. The top of the tongue, is roughened by papillae, and underneath, can you turn your tongue upside down, please? It's smooth and glistening, and it's very vascular. The teeth are clean. They are not decayed or debris. Can you stick your tongue out and move it side to side? Cranial nerve 12 is intact. And can I look once again inside your mouth? Do you have your tonsils? Her tonsils are non-inflamed. They're a size 1 plus 1. Now I'm going to look at your neck. So the head is centered midline. There appear to be no lesions or deformities on the skin of the neck. And I'm going to feel for her cervical nodes. So we have I'll start here. We have the supraclavicular, we have the posterior cervical, we have the deep chain cervical, we have the superficial cervical, we have the jugulodigastric, we have the preocular nodes, and then we have the posterior ocular nodes, and then we have the occipital nodes. Then we have the submandibular and the submental nodes. And from there, I'm going to feel for her trachea, and it appears to be midline. I'm going to feel her pulse. Her carotid pulse is a +2 bounding, it's non-thready, bilaterally, equal. Can you please turn your head to the right and to the left? To the right and to the left. Can you go down? Can you go up? Can you go against my resistance? Down and up. Sorry. Okay, and now I'm going to feel for her thyroid gland. So if you can turn that way. If you could bend down towards your right side. And I'm going to displace and feel. The thyroid is non-enlarged. Was that tender at all? Okay, it was smooth and non-enlarged. And just before I forget, I'm going to listen to your carotid pulse for any bruits. And no bruits are heard. Okay, now I am going to assess her back, her chest, and her lungs, but starting from her back. So first, her skin is brown with no lesions. It's warm. The turgor is fair in the back, and there's no other deformities back here. So I'm going to warm up my hands and just saying the anteroposterior diameter is compared to the transverse diameter is a 2-to-1 ratio. Also, the thorax is an elliptical shape. It's symmetrical. The scapula are symmetrical. And now I'm going to check for symmetrical expansion. If you could breathe in and then exhale and hold. Okay, and then inhale and exhale, like breathe. Okay, thumbs were separated symmetrically, and then from there I'm going to just kind of feel your back, and I note that there's no lumps. The spinous processes form a straight line all the way down, so that's good. And then I'm going to feel for tactile firmitis, so if you could say 99 every time I touch your back.
99, 99, 99, 99, 99, 99.
Okay, I could feel the palpations. They were equal bilaterally. And now I'm going to percuss. Sorry. Okay, and the overall note of the lung fields is timpani, and also we're gonna do a diaphragmatic excursion. So if you could breathe in and then exhale. And I don't, sorry, breathe normal. I don't have my pen on me. Okay, I'm sorry. If you can breathe in and breathe out. And I'm going to palpate down. Sorry, just breathe. Okay. I'm going to mark, can I lift up your shirt?
Yes.
I'm going to mark your back right here. And if you can inhale and hold. Okay. And the result of the diaphragmatic excursion is about 2 centimeters. And from there, I'm going to check for, costovertebral angle tenderness. So tell me if this is painful to you at all. Is that painful? Is that painful?
No.
Okay. So we have no costovertebral angle tenderness. Then I'm finally going to listen to your lungs. If you could inhale and exhale for me every time I put the stethoscope down. Sorry. Can I bring up your shirt?
Yes.
Okay. Okay. Vesicular sounds were heard in all lung fields. There were no adventitious sounds. Now I am going to have you turn around if you can. Okay. And I am going to take your respiration rate. And you have respirations of 15. Your skin color in the front is again brown with no lesions. It's warm and your skin turgor is fair. Now I'm going to listen to your lungs in the front. If you can breathe in and out every time I touch the stethoscope. And let's okay. And we have vesicular breath sounds in all the lung fields, no adventitious sounds. And now I'm going to percuss in the front. And I'm going to do it here. And the overall dominating tone of the lung field is timpani as well. From here, I'm looking over the skin, and there seem to be no lumps or lesions. And I'm going to perform tactile fremitus. If you can say 99 every time I place my palm on your chest.
99, 99, 99, 99,
Sorry.
99,
Do it again.
99, 99, 99, 99, 99.
Okay, thanks. Okay, can you bring your arms all the way up and all the way back and all the way out and up? And then can you let's go. And then your arms, can you bring them up and down? Can you bring them up against my resistance? Can you bring them down against my resistance? Okay. And if you can, I'll stand sideways. If you can do what my hands do, first they'll be supine. You do this. And then can you spread out your fingers? Can you close them in? Can you bring down at your knuckles, and then bring down your hand? Bring up your hand. Can you go sideways and inwards? And then can you clench your fists? Okay. Can you put your hands down and do this valence test? Okay. Is that painful at all? Okay. Now, her range of motion is full, and she appears to have no limitation of movement. Bilaterally, you can sit back down. Thank you. Okay. And there's one more thing that I wanted to check. Can you raise your shoulders? Okay. Strong shoulders bilaterally, equally strong bilaterally, and her cranial nerve 11 is intact. Now, if you can lay down with your head on that side. And if you can kind of lean up on that. Let's see. That was kind of a bad way to do it. Yeah, that's better. And you can lean your head back. It's difficult to notice, but the jugular vein can be seen pulsating, and since she's 45 degrees less, taking the jugular vein pressure is not indicated at this time. So you can sit back up. Okay. If you can, actually, my bad, can you lay back down? I'm just making you go all over the place. Okay, I'm looking at your precordial area, and I'm looking, and there's no pulsations visible, but the skin is still smooth with no lesions. I'm going to feel for your apical pulse. and I can feel it at the fourth intercostal space at the midclavicular line on the left side. From here, I'm going to listen for the other valves. The aortic, the pulmonic, the tricuspid, and the mitral. And there are no thrills or murmurs present. And actually, as I listen to the apical pulse as well down there, I'm actually going to feel it. And there is a pulse of 60, and as I feel it, there are no thrills. As I was listening, S1 and S2 sounds were heard. There were no murmurs or any extra heart sounds. Can I pull up your tank top to look at your abdomen? Okay. As I'm looking at her abdomen, the skin is brown, there's no lesions. It's smooth and warm to touch, it's dry. Her umbilicus is midline. And let's see. I'm going to do the umbilical reflex. And it's positive, it's 2+ reflex. Now I'm going to listen to bowel sounds. Bowel sounds are active in all 4 quadrants. Now I'm going to percuss. First for the liver. Oh, I'm much higher. And we'll go down through. And the liver span is about 3 centimeters. And now we're also going to percuss for the spleen. If you could turn this way, that's helpful, thank you. The spleen cannot be percussed. And also, I'm going to percuss the overall, the abdomen overall, so you can swerve back to the center. There's an overall tone of tympany on the abdomen. And I looked over the umbilicus, and now I'm going to do some palpating. So, are you ticklish? Okay.
A little.
A little. I'm warming up my hands, and I'm just doing light palpation right now to get the overall feel. There's not really any involuntary rigidity. Now I'm going to do deep palpation. And as I'm doing this, I do not feel any abnormal masses. Is any of this tender as I press down?
No.
Okay. Abdomen is non-tender when palpated. Now I'm going to palpate for the kidney. If you can inhale. And I feel the liver edge right there. Not the kidney, I'm sorry. The liver's edge right there. Now I'm going to palpate for the spleen. And the spleen cannot be palpated. Now I'm going to palpate for the kidneys. And the kidneys cannot be palpated at this time. You can sit back down. Okay. I'm not going to go over the femoral artery and the inguinal nodes, but on this patient. But if I were to do it in a real clinical setting, I would look for the femoral artery here in the femoral area at the top of the leg near the inguinal area, and I would feel for a strong pulse, usually a +2. I would see if it was thready or not, and to see if there was any bruise or anything like that, any trouble in the pulse. Also for the inguinal nodes, I would palpate around and note if there was any enlargement, any firmness, if the nodes were movable or not, and if they caused any tenderness. Now I'm going to go ahead and assess the lower extremities. So her legs, there's even hair distribution between both legs. If you could take off your shoes. The skin is warm and dry. It's brown, consistent with the rest of her body, consistent with her genetic background. Her feet are a little cooler, but up in her legs they're warmer. And there are no lesions noted, no bruises. There is no pretibial edema either. The toes, like I mentioned, are a little cool. They're pointing forward. In between the toes, there are no lesions, cuts, or scrapes. This client has no hallux valgus or bunion. Her nails are round and on the edges, and her posterior and lateral skin folds are smooth and intact. There's no cuts or lesions on her feet either. Now I'm going to check if you can stand up with me. I'm going to check your, well actually I'm sorry, if you can lay down, that would be best. Okay. If you can move your entire leg upward, like in a 90 degree. Awesome. And your other leg? Okay. Put down. If you can move your legs outward and inward against resistance. Okay. If you can move your, let's see, if you can come back down to a sitting position and lean all the way back in your chair. Okay. Can you move your knee out? Your leg out, rather. And this one? Okay. Strength is bilateral on both limbs, both in checking for the hip range of motion and now for the knee range of motion. There was full range of motion for the hip and for the knees with no limitation of movement. And now I'm checking the foot or the ankle. If you can uncross your legs, and if I can have the plantar surface of your foot on my hand. If you can push up for me. If you can push down. And same here, push up and down. If you can push out and in. Okay. Equal strength bilaterally. Full range of motion for the feet. No limitation of movement. From here, I'm going to go ahead and have you give me your arm. And we're gonna go over your deep tendon reflexes. But before I do that, I happen to forget this node, so I'm just gonna go ahead and feel for the epitrochlear node. Is it tender or anything? Okay. So the epitrochlear node is non-palpable and the area is non-tender. Excuse me. Now I'm going to check the deep tendon reflexes, starting from, can you sit up a bit? Starting from, yeah, the top. If you can hang your arm down. Is it limp? Okay. Deep tendon reflex +2. Did I do this by myself? Okay. Relax your arm. Deep tendon reflex of +2 there as well. I'm going to check her bicep deep tendon reflex. Is your arm relaxed? Okay. A +2 reflex there. Okay, just relax your arm. And the reflex there is +2 as well. If you can sit back in your chair again, I'm going to do the patellar reflex. Let's see. Can you sit back anymore? Make your legs higher. +1 reflex on the patellar. And now I'm going to do the Achilles. +2 reflex there. And I'm going to lift your foot. Checking for the Babinski. And it's negative. And I'm going to check for soft and distinction between sensation. So I'm going to, if you feel this, it's going to be sharp. If you feel this, it's going to be soft. So I'm going to ask you to close your eyes and tell me which I'm touching you with. Hard or soft? And I'm going to start in your face.
Hard. Soft. Hard. Soft. Hard. Soft. Hard. Soft. 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 Soft.
Okay. Now I'm going to go down to your legs. So you can close your eyes again.
Hard. Soft. Soft. Hard. Hard. Soft. 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 Hard.
Okay. Sensing nerves are intact. Now I'm going to, if you can give me your hands, we'll do one at a time. I'm gonna play with them and I'm gonna put a finger up or a finger down and you're gonna tell me if it's up or down, but you'll have your eyes closed, okay? Okay, is your fingers up or down?
Down.
Okay. Is your finger up or down?
Down.
Okay, now I'm gonna do the other hand. Is your fingers up or down?
Down.
Okay. Is your finger up or down?
Up.
Okay. Is your finger up or down?
down,
Okay, I'm gonna do the other hand again because I didn't do that right. Is your finger up or down?
up,
Is your finger up or down?
down,
Okay, good. And keep your eyes closed, and I'm going to put an object in your hand, and you're going to tell me what it is. Can you figure out what that is?
a key,
Yes, you're correct. So, position sense intact as well as stereognosis intact. And from here, you can open your eyes now, by the way. And now, you're going to touch your finger to your nose, to my finger. We're going to do this quickly. Oh, sorry. Okay, good. You pass. And now, can you roll your heel to down the other shin, down the shin of the other leg? Good. And now the other leg. Good. So, rapid movement. Patient is able to perform rapid motor movements. So good cerebellar function. You can. Let's see. One of the things that I didn't do as I was going through my assessment was checking the temporal artery. So I'm going to check your temporal artery. And I'm noticing that it's a strong pulse. And while I'm up here in the head, I'm also going to do a whisper test that I didn't get to do earlier. So I want you to push the tragus part in and out consistently while I'm going to whisper a word and you repeat it. Backpack,
backpack,
sweater,
sweater,
bottle.
bottle,
Good job. Awesome. And now I'm going to, let's see, I'm going to have you stand up, please. And I want you to walk from this point to that point while I sit and observe you. Okay. Gait is even and balanced. Can you walk on your heels? Dorsiflexion is strong. Can you walk on your toes? Plantar flexion is strong. Good. Can you stand on one foot? Shallow knee bend is good job. You can stand on your feet now. Client is able to perform the shallow knee bend. Can you, if you come over here, stand over here. Can you close your eyes and stand? Okay, you can open your eyes. Are you able to touch your toes? Okay. Can you, with your hands on your hips, lean forward, lean backward, to the left, to the right? Her spine has good range of motion. There are no limitations in her being able to move her spine. And I'm going to look at my notes to see if I forgot anything else. Okay, if you can go ahead and sit down, I'm going to check your pulses. I forgot to check your dorsal, your popliteal. I'm going to sit over here. Okay, her popliteal pulse is strong. It's a +2. And I'm going to feel her pretibial pulses. I'm sorry, her popliteal pulses are +2 bilaterally. And her pretibial pulses are a +2 bilaterally as well. Her pedal pulses are +2 bilaterally as well. One more test that I forgot. If you can put your hands behind your back like so. Good. And this is also to add to her full range of motion. Can you put your hands behind your back downwards? Good. Also, if you can lift up your tank top again. I forgot to check your umbilicus, but to note that the umbilicus is inverted and there is no hernia or signs of herniation. It's not inflamed or red in any way. And I believe that's it. So thank you for coming to get your complete assessment. I really appreciate it.